Posted April 21, 2018, 8 hours, 13 minutes and 38 seconds. It was a comment from her boss 2 years ago that led Jane Parkin on a life-changing investigation. The 64-year-old was working as a pre-primary and kindergarten teacher when her school principal noticed a change in her behavior and suggested she have a medical checkup through the local GP. "We went to a neurologist and had the necessary tests," Mrs. Parkin's husband of 40 years Laurie recalls. The neurologist, over a period of 3 or 4 months I suppose, did a formal diagnosis of it as Alzheimer's. Mr. Parkin now runs the couple's household and farm in the small West Australian town of York, about 100 kilometers east of Perth. "Just the last couple of weeks now I've started doing the grocery shopping," Mr. Parkin said. "I do all the cooking now." Jane has trouble cooking, following recipes and remembering how to do things. The pair, who met as graduate teachers in the Great Southern, have lived in York for the past 10 years, ever since Mr. Parkin retired following an aneurysm. More color, less noise. While his wife's diagnosis has profoundly changed their day-to-day life, Mr. Parkin says he is grateful for a local program aiming to raise awareness of dementia in the community. The pilot project is one of 2 in Wa, the other is in Manjimup, in the state's southwest, managed by Alzheimer's Wa. "We wanted to look at what would happen if we worked with a whole town," Alzheimer's Wa Chief Executive Rhonda Parker said. "That means the retailers, community members, places like schools and hospitals, public transport, local workers receive one-on-one training on how to identify and engage with people with the condition. For business owners, there are tips on how to make the environment less perceptually confusing, such as using contrasting colors to highlight objects or reducing noise wherever possible. It's about being able to identify if a person's disoriented or confused, or not being able to sequence a process of paying at a checkout," Ms. Park said. "Understanding that actually might be dementia, and understanding how you can approach that person, respect and reassurance." The project is being funded through the Wa Country Health Service and is the culmination of 4 years' work aimed at making Wa a dementia-friendly state. "People with dementia will often choose to withdraw from the community, simply because it isn't a supportive place and it doesn't understand their lived experience," Ms. Parker said. This project is all about changing that. To date, 10 businesses have received the dementia awareness training. The Shire of York is keen to see others sign up before the pilot phase of the project concludes in June. "Providing that training and awareness raising to local business is absolutely invaluable," the Shire's Community Services Executive Manager, Susie Haslehurst, said. "It provides an opportunity for people to continue to live their lives in the community that they've grown up in lots of cases, building on local connections." Local business manager Sue Reed, who runs a solar and air conditioning company, has been a member of the project's working committee since it was formed in September. "For us, the aim is to be able to know our customers and make them feel safe still in their homes, if we can go out and see them," Ms. Reed said. "Some of our residents used to teach, our technicians at school are within sporting groups, so they still have that connection, and I think that makes the resident feel a lot more relaxed." For Jane and Laurie Parkin, the program has brought reassurance. "It will give confidence to Jane and to me, that they're going to respect Jane as a person and not this disease," Mr. Parkin said. "There are a lot of people with dementia in the community and they have to be aware of it and cater for it." Tips for creating a dementia-friendly community: make a point of talking to and making eye contact with the person living with dementia first, and not a carer. Be patient with the person. Sometimes it takes a little longer to process the information. Contrasting colors help to identify things, such as cups and plates. The same goes for toilets as well as general seating. Is the exit visible? People living with dementia can become disorientated. Even if they are not able to fully converse in the moment, a little friendly chatter and a smile is good for us all. Source: Alzheimer's Wa Topics, Diseases and Disorders, Alzheimer's and Dementia, York 6302, per 6000.